BHCPF is the Basic Healthcare Provision Fund, and is an aspect of the National Health Act that stipulates funding for providing a basic package of health services for the Nigerian people. The source for that, first of all, is from the 1% consolidated revenue of the federal government, which means when you add up all the funds, all the earnings of the federal government for a year, 1% of it, donor funds and other funds that are earmarked for health within the country. The way the National Health Act has stipulated the disbursement of the Basic Healthcare Provision Fund is that 50% of the fund is supposed to be disbursed to the National Health Insurance Scheme to provide health insurance for Nigerians, especially vulnerable Nigerians, people that are below the poverty line. 45% of that fund is supposed to go to the National Primary Healthcare Development Agency to provide primary healthcare services, logistics, training of health workers, vaccines and other supplies. And 5% of the money is supposed to go to the Federal Ministry of Health to fund emergency services in the country. The first misconception is that 1% CRF is equal to the Basic Healthcare Provision Fund. That's not true, because the Basic Healthcare Provision Fund is 1% CRF plus donor fund, although over time, the donor community has been waiting for the federal government to show the political will of appropriating the 1% CRF. And it's a good thing that the Senate, National Assembly led by Senator Saraki, have done that already. So, we're waiting for the president to assent to it and, so that it becomes law. And it's also not automatic, really, because for state to benefit from it, because the law, the National Health Act, states that if states and local government have to benefit from it, they have to provide a counterpart funding, 25% of the total amount that they are demanding from that. And I think that the third misconception is that people think it's a huge fund. It's not. From this year's budget, it's probably about 55 billion naira, which, when you look at it, is not enough to provide for the Nigerian people. However, what it shows is demonstrating that political will of the government, at least starting to provide some basic package of care for the poorest in our community. And that is one good thing the federal government is doing in partnership with the Gates Foundation, World Bank and the Global Financing Facility to at least begin a phased implementation of the Basic Healthcare Provision Fund in Abia State, Ogun State, Osun State as well as Niger State. I think for the everyday Nigerian, what we urge them to do from Nigeria Health Watch is you need to begin to hold your elected representatives where it is that you're resident for ask questions. Has the health insurance law for my state been signed? If it's been signed, when would the implementation begin? What are the premiums we can pay? Who should we, when we have issues with the plan eventually, how can we seek redress and stuff like that? People need to get more involved with health and health insurance, basically. And I think that's the message that should go out to every Nigerian.